Hello, everyone, and welcome to the Women Leaders in Eye Health webinar series, hosted by Women in Ophthalmology, Orbis International, and Seva Foundation. It is my pleasure tonight to introduce you to one of our co-moderators, Dr. Femida Kherani. Dr. Kherani is an oculoplastics and reconstructive surgeon. She is a clinical assistant professor at the University of British Columbia and the University of Calgary in Canada. Dr. Kherani is the founder of the Canadian chapter of Women in Ophthalmology, is part of the US Women in Ophthalmology Board of Directors, and a founding member of Women Ophthalmologists Worldwide. Dr. Kherani is the immediate past president of the Canadian Society of Oculoplastic Surgery and the president of Women in Ophthalmology within the Canadian Ophthalmology Society. She recently won the Champion of Change Award from COS in 2021. Dr. Kherani, welcome. Thank you for being here.
Thank you all for joining us today for this final collaborative webinar with Women in Ophthalmology, Orbis, and Seva. We are so excited to be here together, and we would like to focus on opportunities surrounding eye health and highlight women leaders in eye health. And I'd like to start off by acknowledging and thanking our wonderful planning committee that has put this wonderful series together. Dr. Sarah Wester, Dr. Aaron Shriver, and Dr. Lisa Nijam represented Women in Ophthalmology, Heidi Chase from Seva, and the team from Orbis, including Claire Salazay, Timber, Gabby Cubias, and the CyberSite team. We want to recognize Claire, who deserves special recognition here, as she was our fearless leader who brought all of us together. And we would not be here without you, Claire, so thank you. During our session today, we are going to focus on leaning in and catapulting our careers by seeking opportunities for growth. Our two panels today are composed of incredible speakers who are leaders from around the globe in a variety of fields within ophthalmology and vision health. These inspiring leaders bring their unique perspectives on issues related to gender disparity. Our first session is entitled Catapulting Your Career. And our second session is Seeking Out Opportunities for Career Growth. So I'd like to introduce my co-moderator, Gemmy Cheung from Singapore. Dr. Cheung is a professor and senior consultant at the Singapore National Eye Center, Duke Medical School, and National University of Singapore. She's the head of the department of the Medical Retina Department and the head of the Retina Research Group at the Singapore Eye Research Institute. She's published over 200 peer-reviewed articles and has received numerous awards for her achievements. Thank you so much, Dr. Cheung, for being with us today.
Thank you very much, Femida, and thank you, Claire, again. So here we will start with the first poll. So the first question we want to discuss is, which of the following has the greatest impact on being promoted to a leadership role in your community? Is it A, networking, B, leadership skills, C, education level, and 4, cultural acceptance? Please click on the pop-up screen and we'll see the answer in a few seconds.
So we can see from this poll that networking is 48%, leadership is 29%, education is 5%, and cultural acceptance of women leaders is actually 19%. So great, thank you so much for participating in our first poll. We have 3 more, so please don't be shy. We're now going to introduce our first speaker, Dr. Vanessa Neoh. And as she loads her slides, I'm just going to share that Dr. Neoh is a specialist in cataract surgery with a specialty in eye plastic surgery. She works at the Island Hospital Penang in Malaysia. She provides a variety of specialized services. She started the eye plastic unit at Penang General Hospital and was leading the oculoplastic faculty. And in 2015, Dr. Neoh was awarded the Excellence Service Award by the Ministry of Health. So we're so pleased to have you join us. Dr. Neoh, please go ahead.
So thank you, Femida, and thank you, Orbis, for the opportunity to present this amazing topic of Catapult Your Career. So how do we go about it? We have to realize that it is within our control. We need a mindset to achieve a level of success in our career. We have to choose and decide what we want. Many of us need to have motivating factors. Motivating factors plays an important role. So what can be a motivating factor? Many of us want to make a difference in society. We want to make this world a better place. We want to have a social impact. Sometimes it also, a lot of us, we need to have a good career, to be financially independent, to give our family, our loved ones a better life too. So having a motivating factor is very important in trying to get and improve our career. So once we have a motivating factor, we need to start planning. Planning is very important. We need to decide, how do we go about it? Do we need to get a fellowship? Do we need to go for surgical training? Do we need to attend workshops, do more research, write papers? Or we need to have a more balanced career, have a social impact, do social work? And to achieve all this, we need to network. We have to have a good network of friends and people who are willing to help and who are willing to support us. So within us, there should be some attitudes that help us have success in our career. Many of us are brought up in a patriarchal society. So we need to be willing to come out of a comfort zone. We need to fight our fears. We need to be willing to be more strong and more independent. We need to be willing to take calculated risks and grab opportunities. For example, when I was offered my fellowship in Singapore, I was working in Malaysia in a very secure and good job. So I had to take the decision to leave my contented job in Malaysia and go to Singapore. And Singapore is a place where the expenses are, the expense of living, the cost of living is very high. And I knew that once I leave my job in Malaysia and go to Singapore, I might eat up into my savings. So we have to take those risks sometimes in order to get ourselves more educated and to have a success in our career. We also need to be willing to make sacrifices without procrastinating. Sometimes we want to go for further studies and we feel that it might not be a good time. We might feel that, oh, the children are still young and things like that. But we have to realize that if you wait and once the children grow up, it might be even more difficult because you will need to bond with them, you will need to interact them, you will need to guide them. So we have to be willing to make small sacrifices and try not to procrastinate. Take initiative to be progressive, to grow and to succeed. And also it's important to be punctual and reliable. This is us in the year 2018. We wanted to actually form an oculoplastic group in Malaysia. So we had quite a few oculoplastic surgeons, about 25 to 30, but we didn't have a proper oculoplastic group or society. So 4 of us women attended this first committee meeting, which was held in 2008. It was only attended by 4 of us. And later on, 2 years later, we worked hard, we took small steps, and eventually in the year 2020 in February, we had the first Malaysian Oculoplastic Conference, which was the first international conference, and there were about 300 attendees. And this was in February 2020, and after which we had the pandemic, which struck the world, and that was the last physical meeting we could ever have in Malaysia. So small steps go a long way. It is important to have a supportive network of friends, colleagues who are forever working, educating, having leadership roles can motivate you and can help you climb higher. Networking also improves your communication, improves your interpersonal skills, it gives you an insight into other cultures and also improves your emotional quotient. So networking is very important when you want to be successful and grow in your career. We also have to be prepared to deal with rejection. Take rejection in a positive manner. Be practical. Think, why did the rejection happen? Sometimes it could be that we need to improve ourselves in certain ways, or sometimes it's just not the time, and there could be some better opportunities waiting for us, and eventually, slowly, with a lot of patience and trying, we will eventually reach the top. So we have to be willing to deal with rejection and slowly work our way to the top and not take it in a very negative manner. The other aspects that are needed to have a good career is critical thinking and creativity. Now, critical thinking and creativity mainly come with collaboration. When you mix with others, you brainstorm, new ideas come out, and that is how we improve our creativity. Not all of us are born geniuses where we can just get ideas on our own. Communication skills and adaptability are also very important. Adapting to other cultures, you can't go for a fellowship in Rome and not want to eat pasta. And when you mix with people of other cultures, it broadens your mindset. For example, this is the oculoplastic meeting in India, where I'm trying to learn a lot from the Bangladeshi colleagues, the Indian colleagues, colleagues from Southeast Asia, colleagues from Nepal. There's always something to learn from somebody. Sometimes you learn from all the right things they do, and sometimes we can also learn and improve on from other people's mistakes. So once you have success in your career, sometimes you might want to go a notch higher. And how can this be achieved? By having a great attitude, by being friendly, approachable, by being humble, self-analytical skills, always fall back, think, is there something you can improve on? Always thinking, no, nobody is Mr. Right. Even at the heights of your career, sometimes there are some certain areas where you might need to improve. Work for a higher purpose, having a social impact also helps. Enjoy your job and have a passion for it. And in summary, how do we improve our career? Have a progressive, growth-driven mindset. Be proactive to achieve your goal. The law of Newton's surprisingly doesn't apply as far as your career is concerned. Things are not just going to fall from the sky by virtue of gravity. You will need to reach out there and to achieve the things you want. Networking and communication is very vital. Having a strong supporting network helps you to achieve success easily. Always strive for fitness and improvement and make a difference in this world during our time here and enjoy your journey. That's all. Thank you for you all and greetings from Malaysia from all of us.
Thank you so much, Dr. Vanessa. Really appreciated that message. I love the message that no doesn't really mean no. It could mean maybe later, and maybe something better is around the corner. And of course, having commitment to our purpose, knowing our purpose makes it so much easier to move forward. So I'd like to have Dr. Murat now load her slides. And I'd like to introduce Dr. Shamsiya Murat, a pediatric ophthalmologist in the Department of Ophthalmology at the National Center for Maternal and Child Health in Mongolia. She is also a board member of the Mongolian Ophthalmologist Society since 2017. And has volunteered as a doctor for various Olympic organizations. So we're so pleased to have Dr. Shamsiya Murat with us today to share her experience. Thank you.
Thank you, Femida. Good morning and good afternoon and good night to all participants around the world. Today, I would like to talk in career development in my experience. I would define for me three sweet spots of career development by the three main factors. It's depending on the individual career interests based on social and professional demands and help and support of organization. So now I will talking on each of these 3 points. First point is individual career interest. Career development depends on the various things such as teamwork, creativity, skills, and social activity and goals. So I want to highlight the part on the blue background. Now I will talking about individual career interest. Mongolian language is official language is Mongolia. English is not widely spoken in Mongolia, and it's ranked 16th out of 24 countries in Asia in terms of use English. Medical textbooks, local languages, very limited, and being able to read and communicate in English is important to know up to date in the medical field, connect with peer other countries, and learn from the world-known experts. I started learning English since my last year of medical student, and I'm still learning. Subspecialty of fellowship program is not available in Mongolia. I have been fortunate enough to get opportunities to study in India with support of Orbis International by the going fellowship in pediatric ophthalmology at the famous Ava Prasad, India, my professional dream came. Family support is also very important. Personally, I do not agree with the notion that women should work at home and men should work for salary. However, the situation in Mongolia is not so bad. Women have the same career opportunity as men. So thanks to the family support and understanding, it was not difficult for me to leave my family for a long and short time period. When I was in India, many people were surprised that I could have 3 children back at home. And there's an opportunity to provide information of public health through the social media or to work with other organizations. I think volunteering is one of the good ways to develop yourself and give back to society. I work as a volunteer doctor for the Mongolian Special Olympic Committee. It is an honor for me to participate in Special Olympics events and work along with many ophthalmologists from the different countries. So I have participated as a volunteer doctors in 2015 and 2019. So goals, I think I made my dream as possibility. My goal is to contribute to mission of safe sight every child as possible. So next point is organizational support. The organizational support is essential for continuing education, especially you are away from your work and studying abroad. How does organization support is save your jobs, pay your salaries and benefits while you are absent, provide a flexible work schedule when studying in the country, and also receiving salary incentives based on your experience and getting professional grades and seniority. As doctors are promoted, they are given the teaching opportunity also. I feel empowered when your organization supports you in such a way. It gives away your confidence, stability, pursue your goal. Next point is professional demand. There were other factors that influence my professional life. 20 years ago, there was 2,000 ophthalmologists in Mongolia. However, pediatric ophthalmologists are less than 10. In order to develop pediatric ophthalmology in Mongolia, we needed to work with doctors from developed countries and get their help. According to 2000 study, cataract disease is the leading cause of blind children in Mongolia. Before my study in India, about 15 to 25 cataract surgery were performed annually. We did not cataract surgery for children at a very young age for traumatic cataract and this leads to nystagmus and poor vision. Only way to cure these children was to get them operated by foreign doctors and children who had to wait for the next visit is international teams. These who could abroad also would go abroad to get surgery for their children. Before pediatric cataract was a big issue for us. Also, ROP becoming an emerging problem in Mongolia. That time, seeing the situation, I really wanted to develop capacity of cataract surgery and ROP screening at the Children's Hospital in Mongolia. Now, currently, an annual number of pediatric cataract surgery rose 90 to 100. So, the end of the presentation, I want to raise this whole message as shown in this slide. Continuous improvement and make your dream goal. And volunteering is also one of the good ways to develop your career. So thank you for your attention.
Thank you so much, Dr. Shamsiya. It's excellent. I love the comments of contribution and contribution locally to your community. We'd like to now move on to the polling question 2. If you could, I will just share that second question here. So the question for everyone here today is, do the laws in your country provide for paid family leave? And we see the answers here. 55% say yes, so that's positive. I'm glad to see that. 29% no, and 16% say I'm not sure. Okay, so we have to check. So now we're going to invite Dr. Professor Ava Hossain to join us. I'm just going to ask Dr. Hossain to load her slides. And as she's loading her slides, I'd like to welcome Professor Ava Hossain, Director cum Chief Consultant of OSBI Hospital. She's a leading ophthalmologist of Bangladesh. Her significant contributions towards preventing blindness in Bangladesh and in the Asia Pacific region are widely recognized. She has as long of 40 years experience in undergrad and postgraduate teaching for different medical colleges of Bangladesh. And at present, she is the president-elect of the Asia Pacific Academy of Ophthalmology and the chairperson of the Asia Pacific Academy of Ophthalmology Women in Ophthalmology Standing Committee. So a definite trailblazer. I'm so pleased to have you here also as the advisor of women ophthalmologists worldwide. So Professor Ava, please go ahead.
Good morning and good evening to all. My topic is catapulting our career. In 1979, in the later part, I went to see my professor in his office and told him about all my dream and career. He said, being a woman, would it be possible for you to do all the work? I said yes, but he didn't convince. So I was very disappointed, but not giving up. I pushed on, made alternate plan and followed through. The alternative was to complete the first part of a 2-part fellowship program, which would guarantee a residency placement. But one had to be accepted into the program by taking a highly competitive admission test. I succeeded to get admission and ultimately passed the Part 1 exam to secure my spot for the residency. So, never take no for an answer. I was placed for the residency training program in the prestigious National Institute of Ophthalmology. Here I was fortunate to work under the mentorship of one of the leading ophthalmologists in the country, Professor A.Q.S.M. Harun. Professor Harun had worked as a consultant in the UK for 16 years and pioneered ophthalmic microsurgery in Bangladesh. I took this great opportunity to learn from the very best and develop my skill in every aspect of the intraocular surgery, as extracapsular cataract extraction, trabeculectomy, injury repair, keratoplasty, and also retinal detachment and all others. After completing the residency and the fellowship Part 2 1-year course, I finally passed the rigorous fellowship exam in January 1985. Grab it by the throat. In the middle is my mentor, Professor Harun, in the Orbis Flying Eye Hospital in 1989. In 1985, I became the first female fellow in ophthalmology in Bangladesh. Today, the number has grown to over 200. I am proud to have inspired many women to consider ophthalmology as their specialization. Nowadays, the scenario has changed. The female residents are higher, that is 60%, and the male residents are now 40%. Be a trailblazer. I'm receiving my fellowship certificate from His Excellency President of Bangladesh in 1985. The Orbis Flying Eye Hospital came in Bangladesh in the year 1985 in March and stayed there for 3 weeks. I had the opportunity to work in the plane to assist the great surgeon, and also I saw the surgery of intraocular lens implantation for the first time and vitrectomy also. I had the opportunity to trained in the Princess Alexander Eye Pavilion in Edinburgh. That is a very sweet story. I will not go in that. And I had the opportunity also to train in the Institute of Clinical Ophthalmology, Kirio, Japan. Never stop learning. This is inside the plane, but this is very new, just 2 years back only. And I was invited there to see all this. Dr. Momosi in TDO in the year 1988, my mentor. And in 1989, we invited Professor Momos to give a oration lecture, that is the Ali Memorial Lecture. And all are my mentors. But the saddest thing is that they are no more with us. In 1986, I was promoted as assistant professor through a competitive exam in Public Service Commission, which was the most important breakthrough in my career. I had to compete with 20 other ophthalmologists for just one position. Breaking the glass ceiling is always very challenging. I found teaching to be one of my true callings. For years, I taught and I supervised postgraduate students, my resident, and the young ophthalmologist of National Institute of Ophthalmology. Guided thesis and dissertation of postgraduate students. I mentored aspiring ophthalmologists throughout my career. Quality mentoring is very important for better outcome. So be a mentor. I kept on pushing the barrier and continued my career growth. By this time, I made my publication, which are very much prerequisite for the associate professor and professor. Keep on growing. The qualities that help me stand out are regular communication, which I always made with my colleague, my mentor, my resident, and very prompt response to all, even the email response. Dedication is very, very important, and I always feel an emotional attachment to my work and a positive attitude for growing relationship, taking initiative, and my self-education by reading, attending meeting, find mentor, promoting professional development and developing leadership qualities. Stand out from the crowd. I got involved with the Ophthalmological Society of Bangladesh from the start of my career and moved up rank over the years as treasurer for 3 consecutive terms from 1987 to 1993, secretary general for 1 term, president for 1 term, and advisor from 2012 till continuing. I'm also the founder president of Bangladesh Community Ophthalmology Society. Networking is very important to be a leader. With the Honorable President of Bangladesh, most left, Professor Bodruddin Choudhury, and I am as Secretary General in an OSB annual conference. With Honorable President of Bangladesh, His Excellency Jilur Rahman, in the year 2011, we have organized this conference and also OSB conference combined. And in that meeting, chief guest is our Honorable President. I was elected in the council meeting in 2011 as President SAARC Academy of Ophthalmology. My association with Asia Pacific Academy of Ophthalmology from 1993, when we organized the APO Congress in Dhaka, Bangladesh. I am directly involved in the council as a council member and also regional secretary of Bangladesh in Asia Pacific Academy of Ophthalmology from 2009. Vice President APO, 2 consecutive terms, 2015 to 2018, and President-elect APO 2019. I'm very happy to say that I'm the first ever female president-elect in the Asia Pacific Academy of Ophthalmology in its 61 years of journey. You were young, you have a lot of time, so the world is your oyster. This is a very memorable picture with His Excellency President of India, Sri Pranab Mukherjee, in the year 2013 in a APO Congress held in Hyderabad, India. And I was there as President Sark Academy of Ophthalmology with Professor Arthur Lim and Professor Dennis Lam. This is a council meeting, APO 2019. And this is the, just before election of president-elect, I have to give a speech of why I would like to become the president-elect. Very happy to say that I'm one of the top 100 women in ophthalmology power list 2021. And the ophthalmologists, they said, quote, "We are proud to present you with the most influential female figure in ophthalmology as nominated by our readers and whittled down by our international panel of judges to the final 100, unquote. So celebrate your achievement." Receiving Alim Memorial Gold Medal from Honorable Prime Minister Sheikh Hasina in 2013, and this is the highest award from Ophthalmological Society of Bangladesh. Another prestigious award, Arthur Lim Award, and after giving the Arthur Lim lecture, this has published in the APO Daily Shows. Receiving Achievement Award APO 2017 from Professor Hugh Taylor, the then president of ICO, and recipient of APO Distinguished Service Award from Professor Frank Martin. He was president APO in 2011. With this, thank you all for your patience hearing.
Thank you so much, Professor Ava. So inspiring. We're very pleased and inspired to hear your story. And we'd like to move on to questions and answers. It's just such a wonderful message in our question answer box. I don't know if you've seen it yet, but one of the attendees said, "Madam, you are the idol of all female ophthalmologists in Bangladesh." So I love that, actually. So I just wanted to share that message with you that's in the question and answer chat box. So definitely very inspiring, and I love the messages. So the first question for our panel is, please share 3 pearls for young ophthalmologists. And I'm going to start off actually with Vanessa, and then we'll go to Shamsiya and then Professor Ava.
Yeah, Femida, yeah. As Prof. Ava has very rightly said, the pearls to success are commitment, dedication, resilience, and to make yourself visible, being active, presenting papers, doing research, and eventually once you're visible and people know that you're hardworking and see your commitment, your road to success is clear.
That's wonderful. I love it, actually. So, Dr. Shamsiya Murat, can you comment as well?
Yeah. So in my opinion, first of all, I always tell my residents to never afraid of shy or not knowing something, because there isn't such person who knows everything. Therefore, a person should always aspire and seek to read more, to know, and know, to not hesitate and ask to know more. And secondly, just never give up. Every failure is not the end, but the beginning. And the last point is learn to balance work and life. And which means that your life shouldn't get the way of your job, and your job doesn't stop you from having a life. Yeah, that's all.
It's wonderful. Thank you. And Professor Ava, you
Yes,
many pearls with us. We're really appreciative of that.
I am very much in with Shamsiya and also with Mongolian speaker, but I would like to say something, that is the young person, the young ophthalmologist or the resident, they have a clear conception, a clear perception what he or she want to do. That should be deal out first, and then there should be a positive attitude, very much dedicated, very dedicated and sincerely about the time, and to honest to the mentor, following what mentor said, doing that thing. And learning is a continuous procedure, so no end of that learning, continue the learning and have a emotional attachment. I always feel that if you love your work, you can succeed. And if you love your work, you will feel better to do that work with a very good initiative and commitment and fulfill your outcome. Thank you.
Yes, I agree. So we have to all do what we love and love what we do. I think that's the key. And then we're going to be emotionally motivated to do more. And I think another big message is we shouldn't be afraid to stand out. We have to be bold, and it's okay to be bold. I think those are great messages. So the next question I'd like to ask our panel is, how do we turn obstacles into opportunities for growth? And again, I'll start off with you, Vanessa.
Yeah. So when you have an obstacle, you have to sit back and don't take it in a negative way. Be positive, An obstacle is always a turning stone to success. Think back and see how you can overcome the obstacle in a very positive manner. And once you sit and think it out, I'm sure there are ways that you can easily overcome it. And sometimes you shouldn't be scared to ask for help. If you need help from people, from friends or from colleagues or from your network, don't be scared to ask for help and advice, and use the help and advice in a positive way, and it should be fine.
Professor Dr. Shamsiya, and then Professor Ava.
Yes.
Yes.
There are so many obstacles for the women, especially as because that is, they have to manage the home, they have to manage the children, they have to manage family, and also do their duty in the hospital. So there is a very good relationship should be there to work and family balance. That should be in mind, that I have to do that. They should not think that this is only I will go to the hospital and do all these things and will not do anything in the home, not that. And commitment, number one, and sincerity, I have told that is also. And if challenging, that is, I have said that I have faced some obstacle, but I think now it is not that obstacle, that is a blessing for me, so that I can go forward. In that way, no obstacle will think this will be the obstacle. That will be overcome by their spirit, by their good attitude, by their positive attitude, and the networking. Yes, I agree with her, Shamsiya, Vanessa, and that is very important. Nowadays, it is very, when we were working at that time, no networking, communication, only physical communication, time to time, and not even this mobile and all these things, social media, nothing else in the year 79, 80, 81, 82, when I was a resident. So these are, you are fortunate. You can see all this and make you overcome your obstacle in your way and fulfill your desire. Thank you.
Perfect. And Dr. Shamsiya Murat, can you please comment also on how we turn the obstacles into opportunities for growth?
Yeah, thank you. So I would say everything depends how you perceive the problem of this obstacle. So a person should always be positive, optimistic, and seek to see an opportunity behind every obstacle. If the person succeeds to be patient and optimistic about this problem, I'm sure she will find a way for the better chance.
That's perfect. Thank you so much. So we have a couple more questions in our chat box, or sorry, in the Q&A that we will address at the end. At this point, we will wrap up our first session. I want to take this opportunity to thank Vanessa, Shamsiya, and Professor Ava. We've had a great session, but we will come back to you in the end for the greater panel discussion. And we're going to move on to our poll question.
Come back to the third poll question. So what are the challenges to obtaining postgraduate training or fellowship opportunities in your setting? Is it language barrier, politics or geographic barrier, exam scores, don't know where to look, or all of the above? Please vote. Here we go. All of the above really is the most common answer. Following number 2 is politics and geographic barrier, and then equally important, exam scores and don't know where to look, and finally language barrier. So if we have time at the end, we'll try to discuss this. So I'd like to introduce the next speaker. So Dr. Helena Hurairah is a consultant ophthalmologist surgeon for the Children's Eye Service in Brunei Darussalam, and is an outreach ophthalmologist for the Brunei Flying Medical Service. She is the president of the Brunei Ophthalmology Society, a council member of the ASEAN Ophthalmology Society, and represents Brunei as an associate regional secretary on the Asia Pacific Academy of Ophthalmology Council. So welcome, and thank you very much for speaking to us today.
Hello everyone, thanks so much for attending the webinar today. It's lovely to be with you all. So I'm just going to go straight into it, and thank you for giving up your time today. So our session here is seeking out opportunities for career growth, and these are my top 3 tips. Now, the first one, I'll just share a quick story. When I first started out in cataract surgery, there was a resident that was before me, male resident, and I went into theatre on my first day, and there were already these implicit biases that were all against me. You know, they were saying like, oh, he just went into it really naturally. He, you know, gosh, it's like he's been doing phaco all his life. And I felt such a pressure to perform, and I didn't. Because, as you all know of surgery, there's a learning curve and it's practice. But my biggest obstacle in the beginning was my mind. I kept hearing what my trainers were saying about that. And eventually, you know, you have to build up this mental resilience in whatever you're doing. But, you know, when you're looking at career growth, it's so important. So really, my first tip is your mind is your greatest friend if you can control it and not listen to the outside noise. And it can be your worst enemy if it controls you. So that is my first tip. Learn to work with your mind in a cooperative way. Now, secondly, stay in your lane. Now, we all have a destination that we're getting to, particularly if many of you who are listening may still be in your residency or fellowship program. So there is always an end goal. there will be different paths. Someone might drop off for a little bit to do, go on maternity leave, go on research. But what I'm trying to say is that there's so many ways to get to your destination. So stay true to your core values. Make sure you stay in your lane. Don't worry about the perceived competitiveness, because let's face it, ophthalmology generally is a very competitive specialty, and it will attract that type of person. And we all have that streak within us. But I would say stay in your lane, stay focused, and stick to your core values. So that's tip number 2. Lastly, your network will be your net worth. And I would love to echo what Dr. Shamsiya said in the first session, that volunteerism, especially within site-saving organizations and in research, you're going to associate and meet people who have the same values as you, who share the same vision. So really surround yourself with people who are in alignment with your vision. And what I would say is that they will travel along with you, along your career journey. And I have such a good time whenever I do go out with the Flying Eye Hospital. I've met the most incredible people, and even some of the volunteer ophthalmologists that I've met along the way, some of them have even come to Brunei and done some volunteer work here. So the networking is so important. So lastly, I'd like to share this from my trip to Mongolia in 2018. And bar Professor Jonathan Song there, who some of you may be familiar with, I would like to tell all the women who are listening today that we are women, and that is our superpower. We lead with our hearts and compassion. So stick to your core values and stay in your lane. And remember, it's all in your mind, a lot of it. Thank you.
Thank you very much for that wonderful talk, Dr. Helena. And we'll come back to discuss some more on the discussion. And you've already shared great pearls to our audiences. So with that, I'd like to introduce our next speaker, and that will be Dr. Susan MacDonald. Dr. Susan is an associate professor at Tufts School of Medicine in the US. In 2018, she left for private practice to focus full-time on cataract blindness and leading a new foundation called the Eye Corps. She has a background in residency teaching, clinical research, and is a consultant for the medical device industry. Dr. MacDonald, over to you.
Thank you. Thank you very much. I wanted to echo a lot of what Helena and I are talking about is confidence. And I think it's critical for your career. And I think it's essential for being a really superb surgeon and taking care of your patients. For me, confidence did not come absolutely naturally, and I have a sense that for most of us it doesn't, but there is actually a skill set that you can develop. And I have spent the last 25 years of my life teaching cataract surgery to residents. I'm the resident surgeon that is bringing these students through their first capsulorhexis, their first phaco, their first SICS. So I want you to really listen to what I'm saying. I'm speaking from my brain, but also my heart. The time and effort you put into building your confidence is going to pay back in multiples. It is going to make your life so much more enjoyable. You're going to be more productive. Your patients are going to do better. Your skill set will improve as your confidence improves. And it will also be a tool that you can transfer from the operating room into other aspects of your life, in leadership opportunities within our field, and also within your volunteerism in your community. So I'm going to just stop here and ask everyone to think about, in the OR, what do you want to be? what is it that, as far as bringing yourself into that operating room, what do you want to be? So what's that? Competent. Of course, we want to be competent. Let's push it a little bit. How about skilled? Well, we can even be, let's say we want to be experts. How about that? How about an exceptional expert? How about I'm able to handle any complication? Can you imagine walking into that operating room and saying, I am so good, I'm not afraid of complications because I know how to treat them and I know how to manage them. So you want to be fearless and you want to be skilled. What you want to be is confident. So you have to ask yourself, how am I going to get this skill set? And I want to define it more than I just want to know, have my skills and be confident in them. And you have to look at your role models. My role model, my biggest role model was Alan Crandall, and he taught me how to do cataract surgery, and he spent his entire life continuing to mentor me and hundreds of other residents that he trained. Richard Packard taught me so many things about complex surgeries, and David Chang has also been a great mentor for me in international work and training residents on a national level. Sam Maskett and also Jeff Tabin in international work. So what do they have that I wanted? Well, they were experts for sure. They had amazing judgment. They were meticulous with their preoperative evaluation and interoperatively. They all had this Zen calm about them, and they were able to manage complications and teach while they were performing a very elegant surgery. They also were very kind and joyful, but I think that came from being incredibly confident. So how are we going to do this? Well, I'm showing you two little videos over here. One video of me just actually doing a capsulorhexis with paper. What you want to master a skill is you need to say, I've done this 1,000 times, because that's what you're going to have to do to master that skill. And so you're going to have to take this on as your work of training your brain and training your hands to work together. And that means at home, that means in the wet lab, and in surgery, you need to take that time. And what you want to understand is there is a learning curve, and that most of us on that learning curve, if we look at cataract surgery, when we get to about 150 cases, we're an advanced beginner. And so that means you don't want to hang on to that advanced beginner place. You want to move beyond that so you can become a competent and then an expert. So in that advanced beginner, in the learning phase, what we're doing that first 150 times is we're understanding the procedure and we're training our little network of these muscle memory, and then we link them together. But in order for us to have this incredible ability to have judgment and the cognitive skills that are necessary in complex surgeries, we need to get beyond that, have an autonomous level of movement with our hands, and so that we can be present enough to work with complex surgeries and cognitively define our problems and present our solutions. So think about that learning curve and know it's a journey that we're all on. And where are you going to get that skill set? Well, where you're going to get it is in the wet lab. And your wet lab can be something as fancy as one of these automated ISIS, where it costs a lot of money for one of those machines, or you can set up your own wet lab in your kitchen table with your loupes, a pair of instruments, and just start tying. What you want to do is train your hands. And then what you're going to do is listen to lectures and also watch skilled surgeons on videos over and over again. Your brain, you're putting down the learning patterns in your brain that will bring forth a smoother surgery. One of the most important skills, and I'm going to highlight this as my pearl, is you need to look at your complications when they happen. That means you need to videotape all your surgeries. And that is where the learning really takes place. It's when we look at the complications that are so painful to watch, but see where things turned and how the complication happened. Could I have picked it up earlier? Could I have managed it differently? Share your complications with your colleagues, someone you trust, and have them review it with you. It's the best way to push yourself along that learning curve and become the expert. Also, as Helena said, you need to train your mind. You need to quiet your mind. You can do that with meditation. You can do that with yoga. That mind needs to be quiet so you can focus it in the operating room. Understand body language. There are power poses that you can use while you stand. You can put your hands up in the air. Your power pose is putting your hands on your hips. And I want you to tell yourself, choose your words, and you tell yourself, I am a good surgeon. I am a great surgeon. I am capable of this. And you need to rehearse the surgery in your brain before you do the surgery. See it happening, even if it's just when you're at the scrub wash table and you're scrubbing. Go through the steps in your mind and just refresh yourself. Do not label yourself. I don't want to hear anybody saying, oh, well, this is my first case, or, oh, well, I need some work on this, or I'm trying this. Do not share those negative thoughts with yourself, and certainly don't say them out loud. If you're going to label yourself in a way that I am learning, I am trying, and I am working hard. Get yourself a posse. You want to be around people that are going to lift you up, colleagues that are interested in collaborating with you and not just competing with you. These are the people that make you better than you were if they weren't in your lives. They're honest, authentic, and they have your back. There may not be many of them, but hold them close. And finally, you need to mentor confidence with others. You need to share. Once you're an expert surgeon, when you're teaching another person, you can share your confidence by telling this person you're believing in them and that you're believing in yourself too as a teacher. That's probably one of the hardest transitions to make, is actually being a teacher and allowing a student to actually work, knowing yourself that you're capable of guiding their hands through it. And know that giving someone else confidence, you're empowering them. And if we're looking to really change the world and make a more sustainable system in countries that have a deficit of surgeons, if you're working there as a volunteer, make sure that you are empowering the surgeons and the nurses you're working with. That's true sustainability, is the training and believing and helping other people achieve their expertise. It's your life, your career, and you should be what you want to be. Thank you.
Thank you very much, Dr. MacDonald, for sharing your pearls. So in the last two talks, we've heard really important messages about confidence, positive mindset, and very practical tips as well. So we'll come back to our excellent panel discussion in a moment. And Femida has got the next poll coming up.
I can read it through there, if that's all right with you. How can you ensure continuous career growth? Number one, being a leader in your local ophthalmology society. Number two, teaching residents and fellows. Number three, conducting clinical trial research. Number four, teaching courses, giving presentations at major ophthalmology meetings. And of course, number five, all of the above. And the answer here is 85% said all of the above. So, which includes teaching courses, giving presentations at major ophthalmology meetings, 8%, conducting clinical trials, 4%, teaching residents and fellows, 4%, and being a leader in your local ophthalmology society.
I think those are all very important tips and opportunities to get to. So we will now move on to the sixth presentation, and that will be by Dr. Prabha. So Dr. Prabha Choksey is the founder of Dr. Choksey Albinism Foundation. This is a charitable trust established in Kenya to reach out to the stigmatized and shunned people, especially the children with albinism. She has over 40 years of experience and has held past roles in both academia and as a clinician. So we are very excited to hear from you, Dr. Prabha.
Thank you very much. It's such an honor and privilege to be talking today and sharing my journey about helping the albino children in Kenya. So today I'm talking about looking beyond eyes. The world suffers a lot, not because of violence of bad people, but because of silence of good people. For generations in Africa, albino children silently suffered the anguish and pain of being born different, white in a black world. In many parts of Africa, they were hunted down like wild animals by witchcraft practitioners in the misplaced belief that their bones and body parts had magical powers of curing afflictions such as cancer, AIDS, and big riches. The birth of an albino child was considered a curse to the family, heralding the breakup of the family unit, with large percentage of children being single-parent children or being brought up by grandparents. The focus of the world all these years was on the skin of the albino children, overlooking the fact that the involvement of the eyes was the primary disability in albinism. Visual challenges of uncorrected refractive errors, severe photophobia, nystagmus, macular hypoplasia, and others led to albino children being forced to attend schools for the visually impaired without addressing their own needs and challenges. In the past, almost 70 to 80% of albino children attended blind schools in Kenya, with a large percentage being taught in Braille. My journey started in 2007, when as a person I felt the anguish and pain of albino children stigmatized and shunned by the society for being born different. As an ophthalmologist, I felt the plight of albino children forced to attend schools for the visually impaired for just a pair of prescription glasses. As a woman, I felt the shame of women being thrown out of their homes for bearing an albino child, a curse to the family. And as a mother, I felt the helplessness of the mothers who wanted to educate their children but could not afford to pay their fees. I realized the urgent need to reach out to albino children as a medical practitioner to demystify all the myths about albinism that were there, as an ophthalmologist to help them deal with their visual challenges, and as a mother and as a woman to offer love and compassion. So my foundation, Dr. Choksey Albinism Foundation, the motto of the foundation is help ever, hurt never. Our belief is service to humanity, is service to God. Our mission is a life of dignity and honor for all persons with albinism. And our vision is to create a society in which people with albinism are fully integrated, appreciated, and empowered to achieve their full potential. So Dr. Choksey Albinism Foundation service is to give a gift of sight by providing them with free ophthalmic services, free prescription photochromatic glasses after correcting the underlying refractive error, and the foundation has reached over 1,000 people. The foundation also gives education to children from low socioeconomic background, single-parent children, and children living with grandparents in Kenya. The foundation supports the education of over 80 children annually. The Help Ever Hurt Never initiative of the foundation assists young people financially and aspiring entrepreneurs and those who need support and to develop skills as music, art, and IT. We support and empower women with albinism and single mothers with albino children. In Africa, albinism is associated with a lot of stigma. Women with albinism get employed, And many women who have children are thrown out of their matrimonial homes and have to bear the brunt of bringing up the children alone. The foundation helps women achieve their dreams. The foundation also raises awareness about albinism through engaging media. Now, interesting observations and findings. With prescription photochromatic glasses, over 95% of people with albinism do not come in the bracket of legal blindness. That is visual acuity of less than 660 or 20/200 after correction. With prescription glasses and little assistance and large type text and high contrast written material, all children with albinism can attend regular schools. Educational support and prescription glasses help children achieve academic excellence, with most of the children supported by the foundation being part of the top performers in the class. Children with albinism are exceptionally intelligent. I think we did not know, but they are very clever. I realized that ophthalmologists and eye care workers spend a lot of time in school health programs examining children with normal vision. So our visual acuity testing charts in schools, like first aid kits, can identify children with low vision and provide the necessary charts. So I have designed these visual acuity testing charts where everything is written on the chart about if it's A, it is 6/60 or 20/200. And like first aid kit, we wanted to actually in 2020, we wanted to put it in all the schools in Kenya, but then the corona pandemic came and this was left. But I think this is something that we would like to take it up. Ophthalmologists can determine what the leaders and the decision makers of the world read and find in the near vision testing chart of Dr. Choksey Albinism Foundation is a prayer of Dr. St. Francis of Assisi. Lord, make me an instrument of your peace. Where there's hatred, let me sow love. Where there's injury, pardon. Our bigger letters are love all, serve all. What God gives is never exhausted. What man gives never lasts. Fruits of my labor, I got the most unique opportunity of a lifetime to demystify all the myths associated with albinism in Africa, such as they don't die but just disappear. Their body parts can cure disease and bring riches. However, the most important myth that I could demystify as an ophthalmologist was that they are all blind and must attend schools for the visually impaired. I got the beautiful opportunity of filling the empty nest of my life with the most beautiful and extremely intelligent albino children of Africa. I was blessed to have received numerous awards, such as Moron of the Order of the Hemisphere from President of Kenya, Bari Bari Prize for Outstanding Albinism Advocacy in the World, among others. But that which is closest to my heart is being called Mama, Swahili for mother, by all albino children of Kenya. Numerous appreciation letters from albino children and their parents, which are a source of tremendous inspiration and motivation for me to continue helping them. This is a letter from Edna, a girl with albinism who had written a letter dedicated to mother. And its beautiful words really make me feel that, yes, somewhere I have touched that child's life. Woods are lovely, dark and deep, and I have promises to keep, and miles to go before I sleep, are the words of Robert Frost. I have promises to keep to the children with albinism, and those who are yet to be born with albinism, that they will have a better life than their parents and grandparents, that they will all be attending regular schools, that they will celebrate life in spite of being born white in a black world, that they will all have opportunities to unlock the potential. And in my now, like semi-retirement, this is what it is. I'm trying my best to keep my promises to albino children of Africa. My favorite quote is, what we do for ourselves dies with us. What we do for others and the world remains and is immortal. Thank you very much.
Thank you so much, Dr. Prabha, for sharing your experience. And with that, I'd like to start the second topic discussion. We've heard from your very inspiring talks, whether it is surgery or whether it is leadership or a foundation, something that you believe in and you love and you want to work upon. So maybe again, we'll go to, so you've decided this is what you want to do. Again, share with our audience, what are the 3 pearls? You've got many tips here. Just like distill it down to 3, the most important. Maybe we'll start off in the same order as the talk. Start with Helena, then Susan and Prabha.
Yeah, absolutely. So I would say, and we've seen a couple of questions there about the confidence. So I'm going to echo quite a lot of what Dr. MacDonald said as well. In terms of the improving your confidence, I would say a lot of it is subconscious, right? A lot of our conditioning growing up, and then what society tells us, and what even in our residencies. So what I would say to improve confidence when you've decided on something, it's all about mindset. It's all about this power pose as well. I loved that photo. It's just several things. Now, what I do know is that for me, as you said, Dr. MacDonald as well, with affirmations and believing in yourself, the time when you're most amenable to that, I would say, is first thing in the morning, last thing at night, when everything's a bit more quiet in your mind. And that's really the time to sit down with yourself, be still, when you've decided, I want to do this. So it's all about confidence. That's when you tell yourself, I am confident, I am strong, I can do this. And yeah, those power poses, I used to do those as well. So that really brought a smile to my face when I saw Dr. MacDonald's slides, and echoing Dr. Choksey as well. Just when you find something you're passionate about, you will get there. But again, for me, it was all about mindset.
Thank you very much, Helena. And maybe we'll move on to you, Susan.
Thank you. Helena and I do not know each other, but I feel like we are sisters from another, because your philosophy really resonates. And I hope everyone's really listening to exactly what she said. You have the power to change how you think. And there are these little voices in your head that are saying things, and they can either be positive or they can be undermining. And if you're operating and you have this voice saying, oh my gosh, the iris is gonna pop out, and then, then I'm gonna have vitreous loss, and you have to shut that down. That voice needs to be shut down. And the way Helena was talking about is these positive affirmations. And then I really do believe you have to have skill, right? So you can't just go into the operating room and think something's going to come over you and you're going to be a great surgeon. Every one of those great surgeons that taught me, they were unbelievably determined and they worked really hard. Nobody shows up in the operating room as an expert. They are home training themselves or in the wet lab training themselves. And that goes on for your entire career. If you want to learn how to do a Yamani technique, the time to learn it is not when you have vitreous loss and you just finished a vitrectomy. The time to learn it is in the operating, in your wet lab, and practice it over and over and over again. And then the time to do it is when you have a controlled case and you have an expert sitting with you. So I agree so much with Helena as far as talking to yourself in a positive way and treating yourself with respect. And the only way to get there is to quiet your brain down.
Very, very great tips. So have a good mindset, be prepared with the practice, and also have a great mentor to be with you. So, and then with that, we'll come to Dr. Prabha for your pearls.
Yeah, thank you very much. Yes, I actually personally believe that real charity and philanthropy, and I think it's when you do charity and philanthropy, it is not for others. You feel good about it. When you're able to help somebody, and even as an ophthalmologist, you feel good. So I feel actually the real charity and philanthropy is give your time, your knowledge and expertise in changing life. And it's not that, for charity, you have to go out of your comfort zone. In your own clinic also, when patients come, like these albinos were coming from all over the country to see me. Can you believe for some of them I had to send bus fare because transport money, because they had no money at all. Some of them did not even have the basic needs in life. So the first thing is the real charity and philanthropy in life is to give your time, use your knowledge and expertise to give. The second thing also in life is to balance your role. Balance your role because finally you're a woman first. You're an ophthalmologist later on. You're a mother. you're a wife, you're a sister, a daughter. So all these have to come to balance. So balancing your roles, you have to know. Sometimes your child is sick and you have a theater list to go to. You have gone through all these things. And I think this mentor-mentee program that will come on later on, for senior women like us, for us, we'll be able to tell how did we deal with that, such situations when they actually occurred. And the third thing that I would say is have some hobby that makes you feel really very passionate about. I'm a numerologist. I look at people like numbers and from the names. And I think probably I was practicing that as well, because these albino children did have a name and did have a date of birth. And for me, that was enough to know what really God wanted out of them. And I have seen such transformation. I'm telling you, it has been the most amazing. I did not know when I started this that I would be feeling so happy in my old age. And for these children who are totally away, they've never seen an Indian woman in a sari. They have never come to Aga Khan hospital before. But when they come and hug me and mama, that's, I think you feel you have done something. Thank you. So I would say charity and philanthropy to be part of your career. Second is to balance your role as a mother, a wife, and also an ophthalmologist. And the third thing is that have a passion, some hobby that you can fall back on in life. Thank you very much.
Wonderful.
May I just comment? I see your heart is so open, and I think that's just another like pearl here, is how to get joy out of life, is just to have your heart be open and you'll find your way.
Definitely.
Yeah. So can I pose the same question, the second question to our second group of panelists here, is that, okay, we've set the great goal. What if some things are not going in the right way? How do you turn those opportunities, turn those obstacles into opportunities? Maybe we'll go backwards and start with Dr. Prabha, and then Susan, and then back to Helena.
I think obstacles, when they come in life, they are actually stones that come in your way. And I believe in turning those stones into milestones, because every obstacle that came in my life, I have felt that I have grown more from it. Because when I started, people said, people will come after you because these people are cursed people and all these things. But when these sort of obstacle comes, you just go over them. And I actually feel that every obstacle is a test for you. That's when how you rise above it is what actually finally determines your success. And I actually want obstacles to come in my life, because I know from there only I will grow further.
Thank you. And Susan?
Thanks. So for obstacles, again, I think they're learning opportunities, and I think we can take from the event. If it was in the operating room, like I said, I think a complication is where you're really going to learn about some error and remediate it. If it's political or social in the ophthalmology community, I think again you have something to learn. And I think if we don't talk about it and kind of dissect it out, there are these opportunities to learn. And if you really don't step back and ask yourself what went wrong, I don't think we'll understand it completely. So, I can think about this one situation where I was on a advisory board, and there was another woman on the board. And what really saddened me is that we weren't collaborating, the two of us, and that she was talking over me, kind of like a mansplaining kind of situation. And so, I left there and I sort of felt like I just didn't, that there was a learning opportunity. So anyways, I reached out to her and talked to her about it. And I think it has made me more conscious about supporting other women in business opportunities. And if a woman says something, to really realize that I don't have to compete. I can support and really lift that woman up.
Thanks very much, Susan. Yeah, I think networking and mentoring amongst women is going to be something that a lot of us are interested in. And after Helena's discussion, we can come back to the bigger group to discuss some of these topics. Helena.
Yeah, no, do you know what? I'm so glad Dr. MacDonald brought that up just in terms of conflict, particularly, you know, within women, because we do need to be realistic. This may not be the setting for it, so I'll retract back to how do you tackle obstacles or opportunities for growth as I like to see them. So in terms of rejections, you know, they're always a redirection. It's never a no, and that's been echoed throughout this webinar. And then in terms of obstacles, the most growth in both my professional and personal life has always been through these barriers and obstacles. So yeah, I think I just pretty much echo really what the last two amazing ladies have been saying, because, you know, they're there for a reason, and they're always an opportunity for reflection.
Thank you so much. I really appreciate all of your pearls. And I love the message, turn the stones into milestones. Take the opportunity to elevate others. This is what I'm hearing through this webinar. Be bold, stand out. I love all these messages. And of course, never forget your warrior pose. These are the things that we need to support ourselves and support others. So now we're going to go into the questions that are posed in the Q&A by our audience. So the first question that I read was, why do female ophthalmologists still lag behind, although the number of female ophthalmologists is rising? So I'd like to invite all the speakers to turn on their videos, and I'd like to go around the panel and ask how we can encourage the women. You know, the women are coming to the table. We're teaching more and more female residents, fellows. They're becoming staff surgeons. But then how do we help them move forward? Be part of committees, be presidents of society. How do we support them to do that? So we're going to come back to the first group.
So I think that a lot of women, they lag behind because maybe the issues with their society or the culture that they are brought up with. In a patriarchal society, sometimes they lack confidence. They are not taught to be strong, taught to be independent. So when we are training them and mentoring them, perhaps we can cultivate principles of confidence, principles of being strong, being independent. And that way we can achieve them, and that way we can help them and uplift them to greater heights.
To be more, we have to encourage to be more active and brave.
Yes, I agree. Be bold. Be bold. Don't be scared to stand out, and don't be scared to ask the question, why not?
Yes.
Why can't there be two women on this board? Or why can't there be more than one woman in this panel? Why not?
Right.
Professor Ava?
Yes, this is very important question. Thank you, Femida. As because we are always, these things are happening in my country, in all other also developing country and developed country also, that women, when any women wants to go for any society's post, that is Secretary General, President post, as because this is happening, maximum are the member are the male member, and very minimum in my country, minimum are the female. So if 100% of female vote for that women, still she didn't win. So that should be, communication should be very much positive to each and every person, not matter that I am only communicate with the women, not with the male. It's regular communication should be there, networking should be there, and very much commitment should be there to each and every. I teach to both the male and female, and male resident are much more during my tenure, but still they are my followers. They are my, still now they are helping me. They are doing a lot of work for me, and they only for that I can win the in a very, very complicated condition, that I win as because all the male and female are supporting me. So that should be the positive attitude of every female person, to make a good relation with all the member, and so that I think we can go. And another thing, we should brave and boldly do our activity. Otherwise, it would not be possible for, in Asia Pacific Academy of Ophthalmology, 61 years have passed, and there are so many active and very efficient women, but nobody is in the post of vice president, or not in the post of president-elect, or in the president. But it has come up. I am not that much capable, but still I have tried, and it has got, everybody support me. And I got the highest and 100% vote in president-elect in the council meeting, when there is a question whether they support me or not, and 100% support me. And that was my, what I said, that it's my, I am very much thankful to all and each and every member of the council. So we should brave, we should go forward. And Susan has said about the confidence. This is very, very important. Self-confidence should be there to move forward. And one day will come that all we can see the globally all our women empowerment at there. Thank you.
Yes, thank you so much, Professor Ava. I think that it's very important to network with all and teach all. I think that everyone here has had, I mean, I have had all male mentors. All my teachers and supporters mostly are men. So I think that we all are here trying to elevate all women. I love the point actually that Helena and Susan brought up about supporting other women in a positive way. I think that is an important point.
Yes.
You know, we have an opportunity.
That is the first to help each and everybody. Women association should be very strong. That is the first. And then we should make our networking with others also. Yes.
So I want to ask now, Prabha, the question, how do we improve our network? Can you, Prabha, can you take the lead on this?
You know, finally, when it comes to a woman, I think she makes her own decisions. Because when I was teaching at University of Nairobi, I was actually living with my in-laws here. So I had somebody to look after my children when I was going to work. So I was a little bit at peace. But I think many young women here, they do not have some support system at home. And I think for a woman, first and foremost is her responsibility towards her children. So I personally feel that in a department, the women should be always very close together. So that today, by chance that I have a problem at home, somebody should be able to take over and do my work. You know, especially if the list, theater list is already there. People have, you know, booked for this operation even 3 months, 6 months ago, and that's the exact day that something has turned up at home. You can ask your colleagues. So we should have a very good, whatever environment you're working in, you should have a very close network that you can do each other's work, do each other's locum, and you know exactly what they want. And I think in such matters, especially in private practice, I think we should not put too much attention to the consultation charges or things or how you'll be paid if you do something. It should be just to help another woman. Just go out and help and take over her work to do something like that. And I think that way, all the ophthalmologists, at least I'm trying to build up in Kenya, will build up situations like that. So in private practice, some of the women, if you need somebody immediately there should be 2 or 3 persons who are there. Now, as and I have also done something because when I realized that, as I was growing older and also a lot of responsibility of albino children, then when it came to surgery, I got another younger woman called Dr. Jyoti Trivedi, who's an excellent surgeon. So now we teamed up. So she would come to do my surgery, but of course the patient would still be mine, pre-operative, post-operative care would be still mine, but I really could offer the patient the most latest and the best surgery and a wonderful outcome. So if 2 women, a senior and a junior, can come together, that I think will be the best combination. Do each other's work, be each other's locums, and patients also know that there are 2 of them who will be there. Either of them can do the surgery, or either of them can see you in the clinic as well.
Thank you very much, Dr. Prabha.
So networking, I think networking is very, very important.
Networking and having women role models and women helping each other. So such as in this group, I think all of us would have faced different challenges, as you've mentioned, whether it's childcare, whether it is politics or surgical skills. So maybe I'll come back to Susan and Helena. So there are questions about overcoming this. Do you have any tips of balancing these competing priorities in life as a woman?
Oh, I'd love to hear Susan's answer.
Well, I think you really need to be true to yourself and listen to your heart. And I think that takes a being quiet. And I found that I wanted to back off on my career when my kids were younger. I felt like I was working so hard, but I had already gotten really good surgical skills, because I think all women, if you're going to have babies, you should get your surgical skills up to par before you do. And then there were times where I just felt so exhausted that I was trying to excel in so much that I was the best surgeon at my hospital. And I just said, guess what, guys? I'm going to take a day off a week and be with my kids. There was no discussion. And I was in the power seat for negotiating because I had a skill set. And I confidently told them, this is what I want. I'm not asking permission. I'm just telling you, but I didn't say it that way, but I certainly decided what was right for me and my family, and I did it. And I think one of the big pearls I tell people is you have to be careful about debt. And I mean borrowing money, because once you borrow money, you are committed to paying it back, right? So if you want a lot of stuff, you want a big house, you want this and that, unless you're a multimillionaire and don't have to worry about money, you're putting yourself in a situation where you're going to have to work. So I think you need to define what you want and then really think that your choice, how you're making your choices and how that's going to leave you in, and that's going to be the reality.
Yeah, so absolutely. I feel, in such this rapport with Susan, because I feel like I'm just kind of like going like, that's what I want my journey to be. So you see, we're constantly mentoring each other, even within our panelists. But what I would say is, throughout my training and my residency, and even now, having more responsibility, is that what I would say is really look after your mental health. In terms of the motivation, balance, because when something is off balance, you intuitively will know it. And, if you feel like your family's life is suffering, it is a time to step back and go, is this in alignment with the vision of myself that I want to be? Because, echoing what everyone said, we're not just ophthalmologists, we're women, we have families, we have husbands, etc. So multifactorial. And when if one of those things and those areas in your life is off, you will feel it, you will know it. So look after your mental health, basically, is is what
Helena,
my
it's
apologies.
just so important the mental health piece, because you're not going to be good for anybody if you're exhausted. And I think as an older person on the panel, I will tell you, life comes in chapters and there are times for everything, but you can't, it's really hard to squish it all into the same time zone. You know, you're just life comes, and it's a long life, and your career will unfold and your family will unfold, and there'll be such great opportunities for you. You don't just have to shove it all in and have it all be at once.
That's a great message. I think that someone once shared with me that you can actually really have it all, but not all at the same time. So there will be times when you'll work more and really focus on your surgical skills. There may be time when you're going to look after your kids and balance that a bit more. Then you might go back to your career and then work really hard again and start a foundation or something exciting. So I think that there's time in our life, just like Professor Ava said, our lives are long. We have a long time to contribute. We have a long time to share our pearls and our experiences, and we have to use our superpowers. Thank you, Helena, for sharing that. So, you know, we have to use our superpowers because we will bring something to the table that perhaps wasn't there before. It's a different flavor. And so I think that I would like to, you know, celebrate you all. Thank you all for being so honest and sharing your souls with us and bearing it, your hearts, because it is hard to talk about everything that we have talked about today. So I would like to end our session here with that note, and thank you all for sharing and for your great presentations, and really appreciate you and elevating everyone. That's really a great message, that we want to elevate everyone at the table and elevate all of ophthalmology, men and women, right? Men and women, because we are teaching all and contributing to our profession.
Thank you.
Thank you.
Jamie, and all.
Thank you all.
Thank you everyone so much for your participation. All of the panelists, your presentations were so inspiring. Thank you all so much. Have a great
Thank you all.
Thank you.
Bye.
Bye-bye.
Bye-bye.